Good afternoon, everybody. Excuse me, croaky voice. I'm Caroline Lecko. I'm the Clinical Improvement Manager at NHS Improvement. It feels like you've had a bit of a sort of gang of us arriving from NHS Improvement at the conference. I personally think that's brilliant, that we've been invited to come and talk about the work that we're doing within NHS Improvement, particularly around pressure ulcers. I'm delighted today to be joined by one of my colleagues, who I'll hand over to introduce herself.
So I'm Rachel Carter, I'm a dietitian, so I don't think there's too many others here. I heard somebody was here yesterday, I think. So I work at Leeds with the job title Nutrition Education Lead. So although I have worked in clinical practice on the wards, I currently work in a wider remit to support education across the trust, and I've done quite a lot of work locally at Leeds, linking nutrition with pressure ulcer care, and as part of that came to work as part of a task and finish group with Caroline at NHSI. So that's why I'm here today.
So what we're going to share with you for the next 25 minutes is some work that we've been doing around nutrition and pressure ulcers. And we've kind of come up with a bit of a strapline around eat well, drink well to keep your skin well. So just to give you, it's really important to say, and Jenny Hall, who leads the National Stop the Pressure programme, would not be very happy with me if I didn't really emphasise that this programme of work is very much linked into the National Stop the Pressure programme. So it's not something that we're doing kind of off kilt. All of the work and activities that we're doing as a group are all signed off by the National Stop the Pressure programme board, so they're well cited on what we're doing. So it is all linked in. So, and it's very much, as we know, nutrition is the N in the S-Skin bundle. And I think certainly my mission is how do we really get the N into skin. So what we've been focusing on is, I guess our challenge was really to consider what the evidence is around nutrition and pressure ulcer prevention and management. And the obvious papers and documents to look at were obviously the international guidance and the NICE guidance. I think it's fair to say that some of that evidence base is perhaps not as robust as we would like. And for those academics in the audience, I think that's one of the challenges that we would kind of throw back to say we would really welcome people to apply for some of that scholarship money to do some more research so that the evidence base is much sounder than it currently is. So the whole kind of remit around nutrition and pressure ulcers at NHS Improvement started on a bit of a journey. I joined the team in February of last year and came with a background of patient safety. I'd previously led the National Patient Safety Agency pressure ulcer programme back in 2010, so I had a bit of insight into the pressure ulcer world. And we got agreement through the National Stop the Pressure Ulcer Board to bring together a group in August of last year as a task and finish group. And we put a call out through Joanne Fillingham, who's the Director of Allied Healthcare Professionals within the Nursing Directorate, to all AHP leads across England. And we had a really positive response to that. So we worked in total with 21 organisations, all of whom are listed there, all dietetic colleagues, even though the call didn't specifically go out just for dietitians, but 21 organisations stepped forward. So we worked with those organisations, and it really was very much a collaborative. What I would just say, somebody was talking about technologies. For the first period, we did all of our work via teleconferencing. We never had any face-to-face meetings at all. This week is the first week I've actually met any of the team. Today is the first day that I've met Rachel. So just, I think it's a really strong, a really good example of what you can achieve with a real focus and, utilising people's time really effectively. I was really honoured to work with the group that I worked with. It was their expertise that has really supported the work that we've done, not mine. I'm really good at nagging and getting people to do things when they say they'll do them. So just in terms of what we did, just to kind of summarise it, we reviewed the current guidance, what's the evidence out there. We reviewed the information on the Stop the Pressure website, and actually Rachel and I were talking earlier. The information that's on the website, the existing information, is still there, and quite frankly it's not great, but I know Jenny Hall is in the process of having that information reviewed and the website updated. And I think we really asked ourselves the question, where do we add value? What's our bit? So I think I'm going to hand over to Rachel now. No, I'm not. I'm doing this slide. I'll do this one. So we had 4 months as a task and finish group to kind of crack on and get some stuff done. And that's quite a tight time frame to deliver things in. So we had to agree what was achievable to be done and be really realistic in doing that. I think I'm a nurse by profession, and we're really good at kind of wanting to change the world, but it's not always possible to do that, and then we just set ourselves up to fail, and the people that feel worse then are us. So I was really mindful of being able to deliver what we said we would deliver, and being really respectful of the time that my colleagues had that I was working with, all very busy people out there in the service delivering care. So we agreed that we would deliver on 3 key areas, which was to provide evidence-based nutrition and hydration key messages to support prevention and management of pressure ulcers, to provide a top tips guide for nutrition and hydration, again to support the prevention and management of pressure ulcers, and to provide a series of case studies that was very much around sharing the learning, and the case studies came from the people working within the task and finish group. So they were our 3 deliverables. We delivered on time. We completed when we said we would complete. We did have a slight delay, but that was more an internal NHS Improvement delay in terms of publication. But we did what we said we would do, and I think we all felt that we'd really achieved something as part of that. And now I am going to hand over to Rachel.
Okay, thank you. So it's just really nice to be here actually, because I've just been round the stands myself at lunchtime, and it's so much about things that I don't know so much about, mattresses and dressings and compression, whereas this work's much more about the prevention. So I'm just going to go through the sort of 3 programmes of work in a little bit more detail about that. So as Caroline said, the first part of the work was about key messages, what did we want people to do. So the aim here was to really take those guidelines that Caroline's mentioned, the NICE guidance and the international guidance, which are quite a tome, even just the nutritional sections, and convert them into something practical. The dietitians that were involved with Caroline were either in the acute setting like myself or some from the community, so we've tried to work together to produce a resource that can be used across sort of both settings really. So the key messages focused on what we did and why as well was included in that. The top tips was the second thing that we thought we should do, which was again to try and provide sort of not a replacement for dietetic advice, but sort of first line advice and top tip information for what carers or professionals could use for their patients or vulnerable groups. And we tried to link those, you'll see on the next slides, the top tips really picking up on the evidence to sort of direct care for the particularly vulnerable groups where nutrition is more of a risk factor. And as Caroline said, we did some case studies as well. So from the people in the group, we've written up some case studies in the sort of NHSI format to try and share learning and be quite honest. And I was just talking to Caroline about this as well. So when this work was published, it was picked up by the trust that I work at as a press release sort of thing. But when they read it, it doesn't highlight best practice, so they were less keen to share it. It's a good news story, but Caroline was quite right to say it's good to show that we're being honest as well, and hopefully other people can learn from things. So just going to go briefly through those 3 different programmes. So the first part was about this key messages. So this is where we developed the acronym EAT. So we try and take that message home today about eating to help stop the pressure really. And we wanted to remind, hopefully, or just refresh people's knowledge about what the evidence is. There is some better evidence base and others, and some is from experience, as Caroline's already alluded to. A stood for when and what to assess for patients in terms of nutrition risk relating to their pressure ulcer risk. and T was for take action. So the evidence really was just to try and remind people that there's lots of implicating factors for poor nutrition and pressure ulcer risk, to try and remind people that there's a risk factors to look out for, whether that's things like low BMI, which is maybe reasonably obvious, or unintentional weight loss, also nutritional deficiencies, obesity, I saw a nice poster on that earlier today, and also quite practical risk factors like if they're impaired, have got an impaired ability to eat independently, which in the acute setting we see more and more people in that older adult population who need not necessarily physical assistance to eat, but prompting and encouragement. So that puts those sorts of patients at risk of pressure ulcers based on experience and evidence. So in our resource, we've tried to prompt all those sort of key risk factors really for when people, nursing staff are usually the ones doing that pressure ulcer assessment of patients. It's important to remember some patients will have more than one risk factor, so risk can be high as well. The evidence also linked to the NICE guidelines that say where oral nutritional supplements should be used in terms of if a deficiency is identified for patients. And really importantly, the evidence said that key thing in preventing was making sure that people were identified early around their nutrition. So if we can identify those who are nutritionally at risk early, we can help to prevent pressure ulcers. So that's real good evidence there, which led on to the A for assessment. So the assessment, again, pulling together the two different guidelines, nutritional assessment and screening. So I think fairly ubiquitously, certainly in the inpatient setting and hopefully community, patients have nutritional screening undertaken these days. But we know, again, we've had nice to have a conversation with someone, conversation today, that sometimes must or equivalent screening tool alone doesn't pick up everything it needs to for patients. So our A for assessment includes the fact that people should be screened, but also picks up on the other evidence base that we should think about hydration. We should think about whether the patient can eat independently. And the guidelines also said that we should think about nutritional adequacy of someone. And I know that's what I'm trained to do. That's what I go to university to learn, how to assess someone's nutritional adequacy, but very aware that that's not what nurses are trained to do. So we shouldn't expect you to do it to that same level. So as part of the resource, we've put some examples of the patient groups who are most likely to be nutritionally inadequate to think around. So whether that is patients who may be on a texture modified diet, or they're on a therapeutic diet, or it's been difficult to assess their nutritional status because of edema or ascites or obesity or social factors. So just some general prompts towards which factors deem people more likely to be nutritionally inadequate. And then T was for take action, and it was really nice to talk to colleagues on the phone, as Caroline said, and hear that although across the board there's a lot more screening going on, we often see in practice that the next step of implementing that nutritional care as part of pressure ulcer care or just general nutritional care what it is sometimes lacking. So we've put some things together about what actions we would want people to do, again linking to the guidelines and the evidence base, to make sure that if the risk is identified, that care plan's put in place as part of that. The second part of the programme was around providing top tips. So again, it was practical top tips guide, trying to again pick up on the different strands of the evidence. So on the fundamental basis, saying that people should have a healthy balanced diet in terms of preventing pressure ulcers, to make sure they're getting all those macro and micronutrients for good skin health. Picking up on hydration, that's important. And then picking up on these more risky groups really. So having information around poor appetite, information about what to do for people who are overweight or obese, and also information for people who are unable to eat independently. So this is just the sort of headings. The documents that we've published aren't very big, but under each of those headings there is some level of information for each of those bullets. And what we did, instead of rewriting resources around healthy balanced diet or poor appetite, we've signposted to things like the Public Health England Eat Well Guide for good balanced diet, and we've used evidence-based existing resources from the British Dietetic Association for undernutrition and malnutrition. So people don't have to, we haven't had to rewrite resources, and it means that you can link to evidence-based, consistent advice rather than us rewriting everything. So the third part was these case studies. So they were have been written based on a standard NHS Improvement format. So each case study is written in the same way to include the issue of what happened, a solution, any specific enablers or challenges are identified as part of that learning, the impact and next steps and sustainability. So I've written Caroline on my notes, but NHS Improvement are keen to add to the case studies as evidence base. And these are all, examples maybe of less ideal practices, what a case study can be, but if people go away and can implement any of the resources and then produce a case study that says we've done this and it's made a difference, and then those would be welcome as well. So we had a result, as Caroline said. One of the really nice things was the fact that we had a very short time scale, and we were very well led by Caroline to focus our time and to think about what was achievable, and it was really nice that within the time frame we were able to achieve what we set out to do, including Christmas, which always puts a bit of a stop on things. So the resources are all available on the NHS website. So what would we like you to do after today? So this is all fairly new, so it was published in January. We haven't been anywhere else to sort of share the information, or it's not been published anywhere else apart from the NHSI website. So it's fairly new. I wouldn't say many dietitians apart from those involved know too much about it. So try and be inspired from today. I don't know how many of you work with dietitians locally, or whether you think you could work a bit better or more closely, or you can go back and check that the resources are in line with what you do, or if there's any particular bits that you can improve on, and those sorts of things. So go and have a look at the links on there. You can direct other people to those as well, and try and share any learning that you have currently or in the future. So my case study was based on root cause analysis investigation of pressure ulcers, which I guess lots of you have examples of as well, so there might be ones that you can share as well. I think you're next.
So just in terms of next steps, because we delivered on time and delivered what we said we would do, we all were feeling quite positive, I think, and I kind of asked the question: do we feel as a group, as a team, that there's more that could be done? And I think that the view generally was yes. So that we've kept the task and finish group going, but we're a smaller group now. So I think there's about 13 organisations, 13 colleagues, I think in total, that are involved in the task and finish group, which our next kind of phase of work started on Wednesday, when we met really for the first time as a group face to face, which was lovely to be able to do that. And we'd already presented our kind of thinking to what we felt would be the next steps to the board. And we were going to focus very much, and are going to focus on raising awareness of the availability of the resources, so hence being here today, and also thinking about some education and training, and how do we support that whole agenda. And that may well link into some of the work that Jackie spoke about yesterday with the education work stream of the wider programme, just to check. We had lots of conversations at the meeting on Wednesday around dietetic student education and how much education those students get in terms of the role of nutrition and hydration in pressure ulcers. So thinking around all of those sorts of issues, engaging with some of the wider campaigns that are currently running across the system. So one of my kind of daytime or after daytime jobs is I'm one of the leads for Nutrition Hydration Week. So thinking about how we can link into that, and we did a little bit on social media to raise awareness of the resources during the week this year. We're also linking in with the Dietitians Week, which is the first week of June. The focus for that week is around prevention, so this sits really nicely within that. So we're looking to do a Pacific webinar around this piece of work during that week. You can imagine how pleased our colleagues are with that. And thinking about what we're going to do for Stop the Pressure in November as part of the campaign, because hopefully we'll be a bit further along with some of the other work that we're doing. We're also focusing quite a lot on conference presentations and publications of articles, so hoping to have an article which has just been accepted by the Nursing Standard, and we're submitting articles to a whole variety of journals covering a whole range of healthcare professionals, so not just nurses, not just tissue viability nurses, but also dietitians, nutrition nurse specialists, and other allied healthcare professionals. We're also looking to develop some top tips for the management of pressure ulcers. We're going to, I think, link that with some work that the British Dietetic Association have very kindly agreed to take forward with the dietitians involved in the group, really, that will develop a new fact sheet for them around nutrition and pressure ulcer prevention and management. So I think we're going to link those two pieces together, so not reinventing the wheel, we'll be able to signpost to that. And also thinking about some other resources that we can develop for patients and carers. So that's our next steps going forward. I think that's it. Any questions? I've put my email address there, and if people want to submit a case study, please email me and I'll send you the template. We would absolutely love to have some more case studies. I haven't gone amber yet, so I'll just share a little story with you. I'm running a nutrition collaborative with 25 hospitals in England, looking at the accuracy of nutritional screening. I was visiting one of those organisations last week, and the head of nursing was saying to me they're doing their improvement programme on 2 wards, one of those wards being an orthopaedic ward, but that both of those wards have frail elderly people. One of their solutions in terms of improving nutrition was to do blanket enrichment of all the meals served on those wards. And she said, since we've done that, we've not had any pressure ulcers on the orthopaedic ward. She couldn't say for sure that it was a result of what she'd done, and I did suggest that she go and look at the previous year's data in terms of pressure ulcers, just to see if there is any connection. Because if we can start building some of those stories to really demonstrate that if you get some of this right, we can impact on so many other aspects of care. So if you've got any really positive stories around improving nutrition and hydration, any case studies about collaborative working with dietitians and nutrition nurse specialists and catering colleagues to look at the service you provide for your patients and service users with pressure ulcers and for your wound management, then please do email me. If you've got questions, email me. I won't know the answer, but I know people who will. And that's just a kind of universal address to send any inquiries to. So thank you very much for listening and for inviting us.
Thank you very much to Caroline and Rachel. So we have time for a few questions, but I think, Sam, you had a question?
Yes, am I on? Yeah. Hi, I wondered, there must be some general principles you can pull from what you've already done around other wound types. So I wondered if that was in the plan, maybe to have nutritional guidelines for patients with leg ulceration, diabetic foot ulcers.
That there's much that the evidence that I found around nutrition in terms of the guidelines isn't really pulled out separately for wounds per se. So certainly locally, we tend to, if someone's got a severe wound, would sort of, as a dietitian, use the same sort of, if I was calculating protein and energy requirements, go down the same line, really also maybe thinking about losses from that wound. So I would say, without any sort of more evidence for wounds, leg ulcers, we would be sort of transferring the information that we've got from the guidelines for pressure ulcers. I think.
Any other questions or comments? So I have a question. So you said that you've come up with a list of areas that you'd like to take forward. Are you looking to collaborate more with other organisations across NHS England?
In terms of the task and finish group, I don't think we won't be, extending that invitation beyond the task and finish group, because certainly from my perspective, and this is very selfish, I need the expertise of dietitians and their advice in terms of taking forward the development of resources. We are looking slightly wider than this particular subject. We will be running another nutrition collaborative and taking that forward with more organisations. Some of the dietitians that have been involved in this piece of work have been involved in the first wave of the pressure ulcer collaborative that NHS Improvement have been running, and that's a really positive thing to see. I think what we saw from people's improvement plans around pressure ulcer prevention going forward, there really weren't any improvement plans that had any mention of improving nutrition as part of their strategy for taking forward the prevention agenda. So I think I'm hoping that if we can deliver resources that are useful to inform clinical practice and support good practice, I'm hoping that we'll be able to kind of take the work forward in different ways.
Okay. So I just have one final comment. You mentioned that you're going to be having a sort of focused week in June. So seeing that we live in the era of social media, it would be good if you shared some of that information with us, because everyone's linked in. So a hashtag, a really good hashtag would be, I think, most welcome by Teach for Ability Nurses. But thank you very much for coming to present your work. Thank you.